Welcome to Hip Hop and Barbells, Tash. Thanks so much for taking the time to join me today.
Awesome. Yeah, it's a pleasure to be here. I was actually so stoked when you reached out to me. It's just nice to reconnect, and I think it would be awesome for us to talk about some of these things.
So you've been DJing for quite a while now. I just
Yeah,
want to ask or give the people a little background about how you got into DJing, and how long you've been doing it for.
sure. So I think I got into it about 10 years ago now. Time flies.
Yeah, it does.
Yeah. Yeah. So I think it was 2015. I had my first gig, but I was sort of DJing in my bedroom for a while before that. And I never really I'm kind of an introverted person. I never saw myself as a performer with this. I just really liked actually I was working out a lot and like enjoying DJ mixes while I'm working out, and I'm like, well, I have certain songs I really like right now, and I kind of want to just make a mix of them so I can work out and study to it and have like a flow instead of always like changing songs. So it was actually more of a practical thing for me. And I had a friend who was learning who taught me how to DJ. Yeah, and I just kind of did it on my own for a while, and people were like, you should like try and like get out there, maybe perform a bit. I'm like, oh, okay. But as soon as I did it, it was just I developed this real love for it, and I've been in the rave community like most of my life as a participant, and then getting to be on the other side of it was really cool because I know what it's like to be on the dance floor and what people need, at different times of a set. So I don't know. It was kind of a natural progression for
I
me.
love that. And right now, you're a PhD candidate and you're specializing in addiction treatment and psychedelic-assisted therapy, but you also DJ. How did those two worlds come together for you?
Yeah, I would say they're still like mostly separate, but they're starting to converge a bit. Kind of when I got off, and it really started to kind of come together. But going back a bit, so I've been in clinical psychology training for a number of years now. And I was always interested in addictions research and treatment for substance use disorders. So I've always been in that kind of clinical research realm. And like most of my research was, on like mechanisms of addiction and different approaches to treatment. And it wasn't until 2019 that I ended up going to a psychedelic research conference with a friend. And I didn't really have any interest or knowledge in psychedelics before, but I was like, okay, like let's check it out. And I had my mind blown because there was a lot of good evidence for its use with treating addictions. And it's a really good emerging field. So I was like, I think I need to be a part of this. I ended up applying to my PhD in clinical psychology at UBC here in Kelowna. And I moved out here and I've been studying that ever since. So that's how I kind of got into that. The way these two have come together is actually more like psychedelic therapy. I didn't realize how much of it is based in music and movement and body connection. And these are all things that are just inherent to, the music community and music events and how it feels to be dancing at events and experience different things in your mind and body. Again, it kind of became a natural, convalescence of the two. And in being a psychedelic therapist, there's a bigger part of it than I thought is in like choosing music and creating playlists to help guide someone through a psychedelic journey. So that's a skill that I already had from DJing, and it's come in real handy.
I didn't realize that you were making playlists with the like for when you were doing your therapy.
Yeah, so
That's
I
really
mean,
cool.
look, to back up a little bit, what the therapy really looks like, and there's different forms. There's people can do it in group settings, but in the research and clinical practice now, it's mostly individual. So it's like one patient, and there's a therapist and a medical person, kind of trip sitting and monitoring and guiding them through it. So this person usually with the high dose is like has like blindfold and headphones on, and they're really like they're in an internal experience. So you're kind of blocking out some of the external stimulus and you're really guiding through music. So the music's a very important part of the
Oh,
experience.
I had no idea that you were actually including music in that. That is so cool.
I'd say without it, it can be kind of weird. And for a lot of people, it could be challenging to really, and almost like confusing, like, where am I supposed to go? What am I supposed to feel? So having music can provide that like structure to an
So is
experience.
it a specific genre of music that they're listening to? How do you decide what to play for
Yeah,
the
yeah,
person?
it varies. I would say what we try to do is keep it like as unfamiliar to them as possible and yet not offensive to the ear. Like it should be like if someone really doesn't like opera, for instance, maybe you're not going to put opera in there because it's going to be disruptive to them, but you want to put something in there that kind of elicits some emotion and maybe a bit of unease. But usually you don't want to put their favorite songs in. Usually things with words that they don't understand is helpful just so that it allows that freedom of thought, because if we're putting in their favorite song, they're going to get wrapped up into a memory or kind of out of this experience a bit. But it tends to be a mix of electronic, organic, classical, world music. We try to keep it multicultural and not like as Eurocentric as possible, like really kind of broaden and open up the mind to new
That
experiences.
is super cool. I had no
Yeah.
idea. I just thought that it was like, oh, you're just providing them with the psychedelics and then you're just guiding them, but the music portion in that too. It's even more connected to your background in DJing too. So you have like a better
Yeah.
understanding of music than maybe the average person. So
Yeah, and I also grew up like as a classically trained musician, and I have like training with like I've taken courses in like music composition and music in the brain and stuff like that. So I don't know, it just this psychedelic therapy really has brought all that together versus before there were sort of these like isolated interests, like these very niche interests that I would get into and then move on to something else, and kind of finally it's all come
that's
together.
pretty cool. That is super, that's kind of beautiful how that came together. And
Yeah.
how does you being a DJ give you kind of more of a unique perspective on mental health and substance use in the music industry?
Yeah, well, I think being a DJ in the community, like, I mean, as a DJ who sort of gigs regularly and also goes to a lot of different events, like to go support or whatever, like I'm very involved in the community. Kelowna especially is a small town, but even when I was in Hamilton and Toronto, I was pretty involved. And you see people and you make friends and connections, and I mean, it's like any other community where you see how people are doing and people are open, and I like to think that I'm pretty approachable, so people often share with me kind of what's going on in their life. I think when you're a DJ, you're kind of like kind of put on a pedestal a bit like any performer. You become sort of a role model in the community because you're facilitating these experiences, but really you're just another person there having a good time. But because of that sort of it almost feels like a power imbalance where people are like, oh my gosh, like you're the DJ and I want to come and tell you everything and share my heart with you. And I love that. So I think I hold that with some honor, like that's like a really nice thing to be trusted. So it's giving me kind of a behind the scenes view of like how people are doing. And you see like if you're observant, you can kind of see when some people are overdoing it with substances, or if they're having a hard time, or they're having a fight with their partner or friend. You can see when people are struggling. So it's important to stay connected and check in with people that way.
Is there a specific turning point where you became passionate about like helping people struggling with drug abuse?
A specific turning point. Yeah, I mean, this is getting personal, but I have my own lived experience with addiction. And I was a teenager, actually, 17, when I went to rehab for my own struggles with substance use and mental illness stuff. So I started my journey really early. But I would say at that time, once I kind of turned the corner and became like kind of whole again, I was like, I really want to help other people with this. And I think that's really common for people in this field, is to feel like, wow, like people really suffer and it's hard to understand what it's like from the outside unless you've been there. So that empathy piece was really big for me, and knowing how hard it is to go through that. And I wanted to help. And I also, I've kind of seen over time how many people sort of fall through the cracks in our system. And I don't think that's any failing of the person. Like addiction, if you view it as a disease, it's like, with cancer, we don't blame someone with cancer if they relapse back into cancer. We say, well, the treatment isn't working and we should try something better. With addiction, there really is a stigma of like, if someone fails the treatment or relapses, that there's something wrong with them, or they, they haven't hit bottom yet or whatever. And I really just never believed that. And I thought we can do better for them. And I wanted to be a part of that solution. So yeah, over time, that's just what's driven me to more and more school and to becoming an expert in this.
If you don't mind me asking, when you were going through this yourself, does that mean that you were have you ever used that same sort of treatment that you now provide to others?
Oh, the same sort of treatment. Yeah, like when I went to rehab, it was like a multidisciplinary, inpatient, structured rehab. And there was group work and individual therapy and psychiatry and nutritionists and spiritual counsel. Like it was so holistic. I'd like to say I've been a part of that kind of treatment since, but that was, I went to the States and then coming back to Canada, and I've worked in like public and privately funded treatment centers, and I've yet to really see the same like caliber of care here. That's also, like I said, that's been like a real motivator for me to improve like Canadian systems of care. Yeah.
From your research and your personal experience in the scene, like what are most common substances that DJs and artists tend to lean on, and why do you think they lean on those?
Oh, most common. Oh my
Is there a
gosh.
most common one?
There's so many. Yeah, it's alcohol.
Alcohol,
I mean, it
okay. Yeah.
is. It's the most common one anyone
Yeah.
does because it's legal and it's accessible and it's sold in the places where we're working and playing, and it's it's something that's become such a big part of our culture when it comes to going out. So yeah, it's alcohol, it's caffeine, it's nicotine, and then there's the other ones: cannabis, cocaine. And it's interesting because I think beyond those ones, you get these like niche sort of like substance cultures that exist like geographically. So there's like the Toronto scene, and then there's this West Coast scene, and then there's like European scene. And I feel like the drugs that exist in all these different communities are kind of they're different. Like whatever the most common thing is, it's not universal. It depends on like that particular little music culture. So for instance, when I was in the Toronto area, I noticed that like ketamine and GHB, MDMA, cocaine, like these were all kind of the most common ones. And then when I moved out west, like those are all kind of around, but you see more like psychedelics, like acid and mushrooms and DMT and whippets. And I didn't know what a whippet was till I got out here and I saw people huffing on a balloon, and I'm like, what are they doing?
What is that? It's just,
Yeah, it's nitrous oxide,
oh, okay.
which is like, I mean, they can give that to you in the dentist's office, but it's a psychedelic experience. It's like an inhalant. But yeah, anyways, you go to different places and you see different music drug experiences that people choose to have, and it's really interesting. With DJs, I think, like getting back to your question, DJs, I think like alcohol really is kind of what keeps coming to mind, and I think there's a lot of good reason for it. Like alcohol is like a really effective social lubricant, anti-anxiety, disinhibition, like I think a lot of the blocks to creativity that are there, like anxiety and self-doubt, and low confidence, is kind of what we're seeking to get rid of to allow that creative flow to happen. So alcohol is like a really good way of doing that.
Would you say that there are any beneficial effects of drugs for like artists and at music events?
Oh, there's tons. Yeah. So here's the thing. If you want me to come on here and say, oh, like drugs are bad, or, there's no good use of drugs and you got to be sober all the time to be your best, I'm not going to say that, because I think they're neurochemical tools. Like that's all they are. They're a tool that we use to achieve a certain goal, which is like a desirable mental state. So and that's we do that with caffeine. So why do I have a coffee every morning? Because I'm a little quicker at work once I've had one. Why do people smoke? Well, they're addicted to it, but also it relaxes them. Why do people drink on a first date? Because it allows you to kind of relax and like be yourself a bit more than you would, because you got all these defenses up. So if you got any of those things going on, which we all do, drugs can be useful. I think the main question is like, are you using the right tool for the job, and is it the right amount? Are you doing it safely? I can come back to some of those things, but like it is beneficial when used in a healthy way. That takes a lot of skill and a lot of like self-control and mindfulness, I would say, to be able to use drugs healthily.
So if someone wants to learn how to, I guess, more appropriately use drugs, like, are they to go to like someone like you that to help guide them through that? Like,
It's just a funny thing to think of, like, am I going to be your drug
no,
coach?
but like
Like,
seriously though, like if you want someone to be like responsible with it and like, I think like education is key, right? Like, even me coming up with like questions to be able to ask you, I'm not looking at it from a perspective of like, I'm only looking at it from the perspective of drugs are bad. Now, you give me a different perspective, which is really important to have. And because there's this other way to look at it, who and how does someone like appropriately utilize these things so that they are not overdosing or something bad's happening to them? Who are they talking to about these things? Are there
yeah,
programs?
and it's really, yeah, I mean, there's so much practical stuff out there. Like, I mean, thank goodness we're in a time now where harm reduction is actually being widely accepted and promoted. And even just a few years ago, like, I was working in treatment centers where I would talk about how harm reduction is important, and they're like, no, total abstinence is the only way. Why would you even talk about harm reduction? Because that's just enabling bad behavior. And I thought that's ridiculous because people are going to use drugs whether we approve of it or not. So taking a moralistic stance makes no sense. So if we're going to treat this as a public health issue, we have to provide information. Like, alcohol and tobacco are legal, and we provide that. So we have to provide harm reduction strategies to that, and we do that by saying, like, if you want to quit smoking, you can do a nicotine only because it hurts the lungs to inhale. With alcohol, there's tons of public messaging from the government, about like how to reduce, alcohol related harms, like, it's practical things. Like, we know that between drinks, you should have a glass of water, and you should limit to a certain number per day, and you should eat before, and you should, drink lots of water after, and not drive for a certain number of hours. And those kinds of things are well known. But with drugs, because they're still illegal, there's still like a moralistic view of like, well, we shouldn't be telling people how to use them safely because they shouldn't be using them at all. But we have that information. There is that information out there, and really people can find lots of stuff online. There's more and more government stuff about certain drugs, about how to use safely. And there's like community centers that hand out like harm reduction supplies, like, clean needles and clean straws, and like things that you can do to prevent like spread of infection and overdose and stuff. Like, you can get naloxone kits at any pharmacy now. So these things are becoming more acceptable and talked about. I would say that there's less information about like some of the more niche drugs and psychedelics and stuff, but that is becoming more available to us. And yeah, I'm absolutely someone who, if someone has questions about drugs or drug interactions, they come to me, and I'm like super happy to answer those questions. But I do think there should be more like government messaging about that, because we have that information.
I remember reading something in one of the online newspapers, but talked about how there is a lot more info on like harm reduction in more BC than there is in Ontario. And I wonder why that is.
Yeah, I think that's probably becoming less important now, because I think the drug harms from especially things like fentanyl are so widespread now that it's like it's kind of needed everywhere. But the reason why it kind of came first in BC is because in BC, especially like in Vancouver, they had some of the highest rates of overdose and drug-related harms, like HIV infection, blood infections, and things like that from people using opioids. There's like a large community of people who have like severe, substance use problems, homelessness, trauma, marginalization, and mental illness, and it's all kind of interacting. And those are the people who are the most vulnerable to overdoses and drug-related harms. So they were the priority to roll out some of these programs. A lot of the programs were actually initiated by drug users themselves. Yes, it was funded by the province, but the people that advocated for clean needles and safe injection sites and stuff like that are the drug users themselves, to protect their community from this. So this really was a grassroots kind of effort, and it was faced with a lot of resistance at first until it's become such a problem that the government, needs to take a public health approach that reduces harm. Because it's simply impossible to like stop people from using these drugs. So why not provide them with a means to prevent some of these things that are easily preventable when they have the right materials and information?
For sure. So with drug prohibition, how it's contributed to the stigma against people in the rave community, what are some of the impacts of this?
Yeah, so stigma with drug use, yeah, like we can talk about the rave community with that, because I think the rave community itself used to be until recently like pretty stigmatized, I think, because of the drug use. So I think, you have this image of people that go to electronic music events and you're like, oh, well, they're doing drugs and they're hedonistic and pleasure seeking and they're being wild and, it's just craziness and, it's just like, it's not the case, and that drug use doesn't have to lead to violence and disorder and harms. It's a really peaceful, loving, connected community. I think that's the biggest challenge that people who don't have any experience with drug use or that community face, is like understanding that drugs in and of themselves are not bad, and that people who use drugs are not bad, and that it's actually can be really helpful for them. So. But I think going back to this issue of prohibition, one of the reasons why we have that stigma is because like there's like all these laws that go back prohibiting the use of certain drugs for not really good reason, I would say. It's really because certain harms did happen, but like there was lots of like research at the time that also showed that these drugs, when used properly, are good. But perhaps because of the lack of public messaging and harm reduction information for people, some of these harms did happen, and they were like, no, we have to shut it down. So there is a stigma that comes from that. You have an image of people that use LSD or mushrooms, and you're like, oh, they're like going to lose their minds and jump off a building or hurt somebody. Right? And that's the image that's from the war on drugs that started in the 1970s, right? So you have this image of people who are going to do wild and unpredictable things when they use these substances, and it can happen, but I mean, the harms from these drugs are dwarfed in comparison to the harms from alcohol, tobacco, and prescription medications. And there's lots of research to show that it's really like many, many times the amount of harms of all these other drugs combined is attributable to some of the legal ones. So it's really unfounded. And I think that the harm that it does to the community is kind of push it into the shadows. And I mean, I'm a little young to appreciate it, but people who were raving in the 80s and 90s know that these were illegal. They weren't in, these like licensed facilities. They weren't, in the light of day, so to speak. They're underground and sort of run by the community, because there was like this stigma and prohibition against drug use and sort of the lifestyle that they were having at the time. So I think that effect has been, kind of internalized by people in the rave community, that, oh, like if I'm doing this, that I'm somehow, I'm different than the rest of society, that I should keep this part of me separate, or secret. This is my weekend warrior identity. Instead of just letting it kind of be like who I am, and I'm open about it. And people are more like that now because it's becoming so mainstream. So I'm really glad to see that.
So conversely, because I don't ever want to demonize anyone who is doing that, but like from your perspective, what would be the risks of normalizing drug use as part of the job for DJs or artists in terms of like their energy, confidence, or creativity?
Yeah. So normalizing it as part of the job. So you mean like people who are using drugs while they're performing?
Yeah, like, or to get through a performance, if they're feeling like there's like a need to utilize something to be able to be energetic, to be able to be creative, are there any risks of like kind of relying on that?
Mm-hmm. Yeah, I would say that like there are risks to it, and it's like with any tool. If you're relying too much on the tool to get the job done, you can't do it yourself. Well, what happens if you find yourself without that tool for a night? Are you going to have a complete meltdown and worry about it? Are you so lacking self-confidence that you think you really need these things to do it? I would really challenge that you can't do a musical performance without any substances. I think that we're really good at learning the patterns, right? Because this thing called expectancies that are a big part of substance use, right? So we learn to expect something out of that drug experience. We take something with the expectation it's going to make me feel a certain way and perform a certain way. And then when we have that thought and we take the drug and it gives us the desired effect, it reinforces this learned pattern. And so it actually strengthens the belief that I need that thing. And if we don't give ourselves experiences without it, so if I don't learn, I don't take the drug, I perform, I do well, then that belief gets really reinforced. We have to give ourselves experiences that sort of give us alternative evidence for that belief in order to challenge it. And so I think what the main risk is that we actually develop false beliefs about ourselves by always taking a certain drug with it. And I think, yeah, I'm way better when I've had a few drinks, and maybe that's not true, because have I really tried performing without it enough times to see if that's true? I think creativity is something that can be enhanced using these tools, but it's not something that exists as part of that substance. It's actually something that resides in us, right? Like it's an ability that's within me that I let out. Maybe that tool helps me do that, but the idea is to actually learn how to do that on my own. There's a saying in psychedelic research, we say, if once you've gotten the message, hang up the phone. So with some of these drugs, it's like they're not meant to be done every day or so many times. It's an experience that gives you some kind of wisdom and understanding about yourself, and then you just use that. And I think that's part of the idea of drugs, is that they give us experiences to learn from, not necessarily to lean on. So when we talk about dependence, right, that's one of the risks. Is one of the main factors of dependence is that I have a belief that I need this. And it may not actually be true. Maybe there's some physical dependency that happens, but that gets washed out as soon as you're off it for a few days or weeks, right? So dependency is one of them. And the other risks that are important to consider is, like, sometimes people aren't using them safely, or they're using too much to get the job done. So I've seen people, take too much GHB, for instance, when they're DJing, and that will ruin your performance, because then you can't function AG out in public, and it's not a nice thing. These drugs can be difficult to dose properly, so you're taking a risk. Like, are you really sure that what you're doing is going to get the desired effect? And sometimes it doesn't. So I think the best way to be, if possible, is to perform as sober as possible. Because that really, the creativity lies within us. Like I said, it's not about the drug.
What happens to the brain over time if someone's repeatedly using drugs? And if they're using drugs maybe with the right doses, what is the difference in terms of how the brain functions over time?
That's a really
Sorry.
interesting. It's a tough question, because each drug works differently in the brain. So I think we can say, broadly speaking, most drugs will affect your dopamine system, which is the system that people are familiar with reward, feel good. It's like, if I have some sugar, that's really tasty and that's nice, gives me a nice feeling, I want to do it again. It's kind of considered an addictive chemical in the brain, but what it actually is a mechanism for learning. So dopamine is what really facilitates our ability to learn new things as well. So addiction really then is it's a learned behavior. So when you take a drug and it feels really good, like cocaine or methamphetamine really stimulates dopamine, for instance. You take these drugs that stimulate dopamine and you learn that link very strongly, and it develops like a pattern in the brain. So I think what it does is it kind of, people use the word hijack the dopamine system. I like to say it overstimulates it, because then normal things, like normal rewarding daily things like exercise and chatting with a friend and getting like work done, and these normal dopamine stimulating things, they stimulate at a low level. So when you start taking drugs that really like flood your brain with these chemicals, you become accustomed to that, and then the normal things just don't feel as good. And we get this shift in values away from like normal rewarding things, and they become less interesting to us, right? So that's what happens with repeated use over time. And so if you're not taking breaks, or you're doing it too much, too often, then you kind of get this fixation on the thing that feels so good. And it can also cause some like mental health issues to worsen, like anxiety and depression, because you are messing with some of the chemicals in the brain. So your equilibrium is off. So it's kind of a stress, like your body's under stress by continuing to overstimulate it with drugs. So that's one of the things that can happen. The idea is, okay, so someone who's using it more occasionally, yes, they're tweaking things, but it's temporary, it's for a specific goal, and it's in a healthy way, and the brain can kind of recover a little quicker. People think that, oh, if I do drugs long term, that I have permanent brain damage, or there's holes in my brain, and those are all myths. Those are stigma and prohibition related myths that simply aren't true. What neuroimaging research shows us is that as little as like 2-3 months after stopping even something like methamphetamine or cocaine, the brain's reward system starts to go back to normal. And so, it's plastic, it's moldable, and we're not stuck doing any one thing. If we don't want to, we can change.
Okay. So when it's like controlled, like let's say they were to go to someone like you, it's not going to have the same sort of effect. Or even if somebody is taking a break, it's going to be fine because it'll kind of like over time it'll just reset, sort of thing.
Yeah.
Yeah.
Yeah, over time it resets, and it depends on the person. There's some things like if there's underlying mental health issues that need to be addressed, then that's probably a good time to address it. Is as they're kind of shifting towards a break from substances, because usually people are using substances heavily because there's some underlying mental health issues. Most people can handle navigating relationships with substances in moderation. It's really like people that are using it because there's like some trauma, depression, anxiety. There's something under there that's really fueling this desire to always be changing the way they feel. And they're having trouble being in their own skin and being like at a normal equilibrium.
Okay. So I'm familiar with how alcohol can disrupt sleep. Does drug abuse do the same thing?
Yeah, no, you're right. Alcohol is really not great for sleep. I would say yes, they all interact with sleep in some way. There's no one answer for how it interacts with sleep. Like cannabis is a good example that it's complicated. So cannabis, there's lots of evidence to show that like healthy use of cannabis for people who have like chronic pain, might have conditions like cancer or like chronic illness stuff. And even people with PTSD that typically have like nightmares and insomnia, cannabis can really help improve their quality of sleep. But then there might be some other people who, maybe their brains are just a little bit different and don't react as well to cannabis, that it actually is a stimulating effect and keeps them up at night. So it really depends on the person. Either way, they do interact with sleep because sleep is a part of how our brains naturally function. But if you're someone who really struggles with sleep, then adding a certain drug like a prescribed sleep medication or cannabis or anti-anxiety medication can really help with sleep. So for some people, it can be useful. Yeah.
Okay. What are some early warnings that someone's drug abuse or alcohol use is becoming a problem?
Oh, that's a really great question. Yeah. I would say there can be really subtle changes. These things are usually noticed by people who are close to the person. So I would say that some of the early signs are, it's obvious things like they're using more. You're observing this change in behavior where they're using more and they're starting to find more and more reasons to do it. So when we think about like diagnosis of a substance use disorder, which is the clinical term for what we used to call addiction, but really just means like drug use is getting problematic. The hallmark signs are people have cravings to use. They have like urges to use that, they're having trouble controlling or saying no to. They might have attempts to reduce or stop their use and they kind of, they're just not able to, or they have multiple quit attempts and they go right back to doing it. A lot of it's like kind of internal feelings of shame and guilt about their use. And this may not be observable to other people because we like to kind of keep those things private and hidden. But that can kind of manifest as like people doing a lot more like rationalization around their use. Like, oh, I'm using because it's so-and-so's birthday, or, it's the weekend, or, like making more and more reasons to justify behavior kind of indicates to me that they're not controlling their behavior anymore. That's getting out of control. And we're really good at kind of wrapping our mind around to change our beliefs about our behavior to make ourselves feel okay about it. So that to me says there's some shame there. The more obvious signs are someone might have changes in personality. So becoming more irritable, spending less time with friends and family, spending less time on things they enjoy. Really, when someone says to me, like, I just don't recognize them anymore. I don't know who my best friend is anymore. They're not the person I used to know. That to me says that there's something going on mental health or addiction wise. So those are some of the signs, yeah.
Okay, so let's say somebody does recognize that, hey, maybe I'm using too much and I don't really have control over this. What are some practical harm reduction strategies that you would recommend?
So you're saying as the friend, or as the like if the person recognizes in themselves they have an
Yeah, maybe,
issue, or
or if you can give both perspectives. Yeah, like if you're a family
yes,
member, friend, and you see that your friend is maybe they don't really have the tools to be able to like cut down, what would you recommend?
yeah. Oh yeah, that's a tough one. A lot of people have felt that pain of like watching a loved one go through this and, are not doing well and are having some like health related effects, or their like mental health is deteriorating, or their work performance is deteriorating, or they're not seeing their loved one as much. It really helps to have a very honest conversation with that person, and keeping in mind that people at that stage usually have some degree of shame associated with what's going on, and they're going to be very sensitive about how they're coming across or how they're affecting others. So the conversations we need to have with people are very non-confrontational. So it's not like you have a problem and you have to do this and you need to go to rehab. That really doesn't get the desired response from people. You really have to put yourself in their shoes and imagine, okay, if this was me, how would I want to be spoken to? And that typically is like a, hey, I've kind of noticed that you're not really yourself lately, and I really miss the time we spend together. And I just wanted to know, is everything okay? Is there anything you want to talk about? And really just allow that open discussion. And at the end of the day, it's really up to that person if they want to change. So the most important thing for loved ones is to leave the door open and not cut them out unless it really is an unsafe situation for that person. If that person is a threat to themselves or others, we have to take immediate action. And beyond that, we got to just support someone on their journey and maybe ask them, hey, like, if you're interested, I have some resources you might find helpful. I'm kind of worried that when you're using your sort of, you went to the hospital a couple times, or, you kind of woke up in a strange place, or you fell down, hurt yourself. Like, I'm wondering if there's some way you can, maybe use in a way that's not going to be so harmful. And I have these resources, and, you can ask if they'd like to see them. It's kind of conversations like that where you have to be really tentative and just offer instead of forcing it on people.
That's good, because shame can be more of a deterrent more than anything.
It is, yeah. And like I said, the confrontational approach really just like compounds shame. And what it does is it puts someone on the defensive. So the way that people work, and there's a lot of research behind this, is when we talk to people and you present them all the reasons why they should change, like, your drinking's out of control, and, your doctor told you should stop, and you're spending too much money, and you've got 2 DUIs, and you see all those things. You say, aren't you going to get help? How do you think that person might respond after receiving all that?
Compassion is king.
Compassion's king.
Yeah.
So it puts people on the defensive. And so when you say, like, asking open questions like, how have you been feeling about your relationship with alcohol lately? Or, how are things going? Is there anything that you want some help with?
Yeah.
It just really open.
So
Compassion. Yeah.
So if somebody recognizes within themselves that, hey, I can't function without having to utilize this specific substance, whatever it may be, what are the steps that you would recommend they take to maybe help them with like more like harm reduction?
Yeah, that's a great question. So if someone has kind of recognized that there's an issue, amazing, great on them. That's the first step to getting help, right? And that's such a cliche thing to say, but it really is, because once we have a goal in mind of, wow, I'd really like to reduce this, it's natural for there to be a lot of ambivalence still at that stage. It's like, wow, I really want to reduce this, but I really like it. And, if you're a DJ, it's like, well, I've got this gig coming up and I've got all these performances and I really can't afford to stop using it now. And, I think that's really the time to get some help. like be it professional or a trusted friend who's kind of been down that road. There's lots of people in the rave community that are actually functioning, walking around completely sober and maybe have a history of that, but you may not know that they're sober or not. So I think just starting to talk to your trusted friends and say like, hey, this is going on. I'd really like to maybe get a handle on this. Have you any experience with this? Do you know anyone who's been through this? And just building those connections, that really reduces the shame as soon as we meet people that have had similar experiences. And then also getting like professional counseling is always good for that. And if it's just a matter of like reducing harms, like figuring out a way to use safely, then there's like harm reduction outreach, support programs, there's community resources. These are usually like community-based settings that might do like safe needle exchange and like handing out supplies and stuff, but they're also very knowledgeable about knowing what drugs interact well and what don't. And so you're like, hey, like every time I DJ, I'm drinking and I do ketamine and I find like I can't function well and I'm like, not performing well. They might say, hey, those things are both depressants on your nervous system and they're going to make you really woozy. Maybe choose one or the other that day. It's very small practical things like that that can make a big difference for some people.
Mm-hmm. And you research ketamine-assisted therapy. And I once watched a documentary series about how this girl had some sort of, I don't know if it was an autoimmune disease. I don't know what kind of disease it was, but she went to Mexico and she did ketamine-assisted therapy, and it put her into remission. So that was the first time I heard about that. And then when I looked more into your background and how you also researched this, how can that therapy assist people who maybe are a little bit more resistant to like a traditional rehab or therapy?
Oh, that's a great question. I'm so glad you looked into that because ketamine therapy is really interesting. So it falls under the umbrella of psychedelic assisted therapies. And ketamine therapy is currently the only one that's like fully legal that you could go to a clinic and legally get ketamine assisted therapy. Most of it is privately like paid for. Some of it is covered by insurance. That's mostly treatment resistant depression. But you can go to ketamine clinics to treat a variety of issues. So I would say, like in some of the work that I've published, we've like interviewed therapists and their patients at ketamine clinics. And some of the most common things that they come in for are, like you said, that they've tried other therapies. Like most of these people have come in, they've been on multiple medications, they've tried different talk therapies. If they have substance related problems, they've been sent to a rehab and they're like, you know what, that really didn't fit with like my values or my religious beliefs, or like, I just don't think I'm like, quote, an addict, but I'm feeling kind of stuck with my substance use. Those are people who might be good candidates for psychedelic therapy, because it is kind of outside of that realm of like total abstinence, drugs are bad. We're using a drug experience to facilitate therapy in a way that they've been stuck before. So most of these people, they find with the ketamine experience, they can access feelings, memories, and like thoughts that were kind of off limits to them almost before. So that's one of the ways that it works. And also ketamine for itself is really good for depression through the neurochemical aspect. It's sort of like a depression medication of itself. So we find for anyone who's having like drug related issues that are linked to their depression, for instance, and they're having a hard time like managing their substance use because their depression isn't treated well, something like ketamine therapy might be very effective for them.
Is that illegal in the States?
It's legal.
Oh,
No,
it
no,
is?
it's there's lots of ketamine clinics in the States and in Canada. Yeah. So ketamine's actually it's a medication that has been used in hospital settings for like 70 years, usually as an anesthetic and pain reliever. But it's sort of off-label use is like, oh, it has like psychedelic properties and it's really helpful in talk therapy.
There is a stigma or confusion about psychedelics in therapy. What is most important for DJs and artists to understand about their safe and their supervised use in a clinical setting?
That's a good question. So the use in clinical settings, first of all, is very different from how we use these substances recreationally. So I described it a bit before, but really, like, I kind of painted a picture of, someone who's being guided into a very internal, personal experience. So what we're doing when we're using it in psychedelic assisted therapy, we're using it as a way to manage stimulus right? So what happens is when you introduce something like psilocybin, which is what I work with mostly in therapy, when you introduce something like psilocybin, it really allows the brain to make different connections and kind of operate in a way that it doesn't when you're walking around in your normal sober state. So you're going to have thoughts and feelings and sensations that interact that are completely new, and that we call them hallucinations, but really they're just perceptual kind of things that come up. And when this is happening, it's really there's a lot going on. You see a lot of things, you're hearing a lot of things. It can be very overstimulating. And so in a clinical setting, we do a lot to manage external stimulus by giving them like eye shades and headphones, so they're not distracted by what's going on around them. It's usually a nice, dark, comfortable room. You got one or two people there really like sitting with you and guiding you, and you're on a nice, comfy couch. Like it's very chill. Compare that to when you're in a rave setting. It's all stimulus. It's loud. There's lights. There's fog machines. There's tons of people. There's a lot going on. And so when you're using a psychedelic drug, for instance, in that kind of a setting, you're going to have a very different experience. I would say what DJs and people who go to raves should understand is that if you're going to a rave and you're taking a big dose of some psychedelic, it's going to be very different than how you would do it with a therapist in a controlled setting. I'm not saying it'd be a bad experience. You can gain a lot from it, but you're also probably more likely to have what we call a difficult experience. And usually what that is just you're overstimulated and there's some internal stuff that's coming up, like anxiety or like guilt or like thoughts about things that is not convenient to face in that moment. So your brain's kind of repressing it. So that's when we see people start to have a hard time. And usually all it takes is getting them to a nice quiet corner, nice quiet couch or something, and having them like drink some water and breathe and chill. So really it's that overstimulated feeling that can contribute to like a bad trip at a rave, for instance, which is easily managed when you have people there who are like harm reduction trained, for instance. So I would say, for people who are in that community, making sure you got someone there who can spot someone having a hard time and respond to them, can stop them from going to the hospital when they really don't need to.
I have a question that might be a stupid one, but does water help with when you use drugs, like preventing some of the
Yes.
side effects of it? Just like how if you drink.
Yes, dehydration is such a big deal,
Okay,
right?
okay, because I wasn't sure, because I know with alcohol they make a recommendation of if you're going to drink, have a drink of alcohol, but then a drink of water afterwards. Can the same thing be used for when you're using drugs? And how much does dehydration impact how your body responds to the drug?
Yeah, that's such a great question. So one of the main harm reduction strategies we use is take care of your body.
Okay.
Make sure you're hydrated, you have a meal, like stretch, make sure you're wearing comfortable clothes, have like if you take medications, make sure you've taken your medications that day, use supplements that might help recover from the effects. Like these are all very practical things, and water is a big part of it. One of the main contributors to drug related harms at like raves and festivals is people don't drink enough water and they get dehydrated. So that could be prevented. Like they're just really high, and like, stimulants, for instance, they crank up your body temperature and they make your heart beat faster and they make you dehydrated. So you got to make sure you're drinking water and getting like electrolytes in as well. So like drinking Gatorade can be really good. The only exception to that is with MDMA. It can make you really thirsty. And if you take a lot of MDMA, there's something like, it's called, can't remember the term, but it's basically you're overhydrated, like you drink too much water. And that can be dangerous too. So, just making sure you have the right fluid balance is important. But with alcohol, always more water is better.
And food, is that the same thing with food around drug use? Like, should you be eating around drug use? Like, is that going to impact
Yeah.
how that affects your body as well?
Yeah. And the interesting thing is a lot of the drugs, psychedelic drugs and stimulants, they make you not want to eat. So if you're using a lot over a long period of time, like several days, for instance, and you're not eating enough, then you have issues with you don't have enough energy, you can faint and stuff like that. So yeah, making sure that you're bringing small snacks. Like I always recommend if you're doing psychedelics, bring like fruit and cheese and nuts and like kind of these like nice whole foods and water. And those would tend to be the things people are more interested in eating on those drugs versus something highly processed or meat or bread and stuff like that.
So if there's like a piece of advice that maybe you can give to any like DJs or artists who want to kind of protect like mental health while thriving in the music scene, like what would it be?
Oh, I would say my biggest piece of advice is that it's going to sound really cheesy, but I mean it, is like be true to yourself. One of the biggest pressures we have as artists is to be liked, is to be successful, and to produce lots of content and material. And I think that we should be resisting that and like really rest in who we are and know that people love us for who we truly are. When we're really enjoying ourselves during our performance, that's when the audience feels comfortable to let go and be themselves. And so the more yourself you can be on stage, or in interacting with people, the better. And I think that a lot of the things that get in the way of that are beliefs around I'm not good enough, or I have to have a certain image, to be successful, or I have to produce a certain amount to be successful. And I think if you're chasing really, really big dreams like that, then maybe that's true, but it's not always the case. And some of the most successful people out there are those who just let their inner selves shine and don't rely on excessive drug use, to achieve these goals. Like, we're not trying to crank ourselves up into some version of ourselves that isn't genuine. I think people really end up liking us when they get to know the real us.
For sure.
So that's my
Oh,
advice.
that's beautiful. And then what's one thing you wish more DJs and artists understood about the brain and its ability to heal?
It has a wonderful ability to heal if you allow it to. And that goes to my other point about not trying to force it into something that it's not. Each one of us has a really unique and beautiful brain and personality, and we are ourselves. And I think what we try to do with drugs is try to tweak things into a way to achieve our goals, that aren't sustainable and aren't going to lead us to be able to be ourselves and be healthy while performing, at a high level. So I think that it's important for us to remember to take care of our bodies first and foremost. Make sure you're prioritizing sleep, water, food, exercise, and quiet time. Because in the music community, there's just so much we can always be doing that isn't taking care of ourselves. But we got to do that if we're going to do this consistently.
Absolutely. And where can people go if they want help but don't necessarily know where to start?
Yeah, I mean, I'm very happy always to be a contact or a starting place for people if they have questions, and don't feel comfortable going to like a doctor or somebody. But I always recommend that if you have concerns about your mental health or substance use, that you tell your family doctor, that you talk to a counselor. There's group support meetings that are like totally free and you can just drop into and are no pressure. These are all things that are available online or in person. I also recommend, if you're looking for harm reduction stuff, that you go to like a local community resource center that does harm reduction work. And that depends on where you are. So I can't make specific recommendations, but I'm always happy to help people find their way through our systems. But there's lots of resources available.
Where can they reach you?
You can reach me on my email. It's tashia.petker@ubc.ca, or you can find me on Instagram at Sheebz.
Awesome. Thank you. This was so informative because for me, I don't know that much about drugs. I haven't experimented with drugs at all, so I don't know how it.
Oh, really?
Yeah, I don't know how it impacts the body, the brain. I don't know very much. So it's awesome that I have someone who not only DJs but also has the experience of trying and then also helping others with psychedelic use. And honestly, I'm not gonna lie, I had a perception of drugs is bad, but I never look at it from the perspective of there might be some good use to having drugs, to utilizing it, so depending on how you're using it. So that was really informative, and I love that I could ask you so many of these questions. So I just want to say thank you, that this was amazing.
Oh, thank you so much. I think it's really cool that you're willing to have your beliefs shifted. So many people are not open-minded enough to allow for that, because once you get into the gray area of this stuff, it's really hard to go back to a black or white belief about drugs are good or drugs are bad. And after years in this field, I'm just I don't know if they're good or bad. It's an in the moment, person to person decision at the end of the day. What is this going to achieve for you? And yeah, I mean, the other thing I've seen happen in the rave community is like people can have really powerful therapeutic experiences on the dance floor with no therapist, no doctor, you know, with or without drugs. Like sometimes the music and environment alone is enough, but like I've seen people like heal traumas and, you know, like reconnect with people after having like a really dark period in their life through music. And it's just the most beautiful thing. So I can't say drugs are bad after seeing that.
But that's good to get that different perspective, right? So,
Yeah.
yeah. So thank you so much for joining me today.
Oh,
Yeah, you were amazing.
well, thank you.
Yeah.
It was really nice to do this. Yeah, I've never been asked to talk about like the intersection of all this before, and it like was nice and challenging for me. Thank
No,
you.
thank you. I appreciate you taking the time and like sharing your knowledge. All
Cool.
right. Thanks, Tash.